Hey, it's Scott. And I'm here at the Tennessee EMS Educators Conference. And this afternoon, we had the pleasure of meeting Darlene, who's here as an exhibitor from Danny's Dose. And with it in mind, kind of a unique title, Darlene, what exactly is Danny's Dose?
Danny's Dose is the organization started by our family in 2015 when, because of hemophilia for us, we realized that nationally we have outdated scope of practice that prohibits paramedics from administering patient-carried meds. Well, we were taught at the beginning, never leave home without that clotting factor. There's not going to be time to go home, come back to an ER, and it's only available at level 1 trauma centers. So you just can't leave home without it. We never did. And sadly, we had a friend who had an automobile accident, could not get his clotting factor administered. Fortunately, his wife got to the ER and, without permission, administered it and saved his life. We knew that something had to change, that more people were going to die. And the fear of, oh my goodness, what do we do? And we knew it had to change. So kind of my tagline is, yes, Danny is still here, and the goal is to make sure that everyone's Danny is still here.
I like that. And when I looked at this, that was a really good reminder, because as we were talking about right before we started taping, a while back, a paramedic and respiratory therapist educator, Stu McVicker, was doing a presentation, and he brought up this same idea. He said that they had a child who had a tracheostomy, a ventilator, G-tube, lots of bells, whistles, and toys in the community. And they went out and they talked to mom and said, so mom, if your child has issues, what do you expect the paramedics are going to do? And she listed X, Y, Z. Then they talked to the paramedics and they're like, yeah, no. Our protocol says we can only do PDQ, and it was vastly different between the two. So as we were touching on before we taped, you had a fabulous idea, which is if you have a child in your community, or even better if it's your child, bring cookies. Go to the fire department, and even better, bring the child.
Yes.
And say, here, this is what you're going to see. This is what they look like. This is how they act. Whether it's because they have a trach or hemophilia, as we'll touch on, or if they have autism of some variety.
Right.
Go talk to them and say, this is what works. This is why I'm going to call you. This is what we normally do. And it's just going to make your future interactions so much easier. But with that, one of the things beyond the board that I thought was just really, really cool is, Darlene, can you touch on this idea? Because as a paramedic and ER nurse, I'm like, honestly, this is wicked cool.
Thank you. So it's a headrest cover. Goes on the headrest of the car, draw a string to keep it tight, and then different headrest sizes it'll fit. But this pocket is for the emergency orders. And that is one of the key things in our work and in the 7 states where we've been able to pass regulatory changes, is a paramedic in those states will be able to treat based on the orders of the patient specialist. Those orders have to be readily available. You can't need to dig through a purse or a glove compartment or whatever. Have them in this pocket. And so immediately in an automobile accident, if the parent or the patient is unconscious or there's confusion just because of fear and anxiety, those papers will speak for you. And plus it's from your specialist on the letterhead, signed, dated, updated annually. So for families that we have gotten to know and that they have been trained by us, they're going to have these in their automobiles and have those pieces put together.
Does it only have the order from the specialist, or does it have here is what this medical condition actually is in 50 words or less? Because if you have XYZ syndrome that nobody has heard about, having some sort of a short, sweet summary, is that something that's included, or is it mainly here is their condition, this is what they need, I'm Dr. XYZ, and I say you should get this?
I pretty much I have them keep it down to the emergency orders.
Okay.
Short and to the point. I feel like if they want to know what XYZ is, they can Google it when they get back
okay, that's very
to the
reasonable.
station
okay.
and figure out more. Or sometimes we've had paramedics then come back to meet the family after everything's all calm and they're back home, and then have that discussion about how do you get this? Where does it,
Right.
is it hereditary or whatever? And then that helps build a relationship. But we really prefer our families go build a relationship first, as I tell them, on a calm day. and you create your treatment plan and make sure
Absolutely.
everybody gets educated. So our goal is really, truly a comprehensive solution to a very real problem. And very real, I mean, just in 2023, there were 6 deaths. And I can't say that without tearing up. It's just not okay. And it's in states that have disregarded when I've tried to contact them and tried to assure me that there's no problem in their state, that their people can take care of whoever they need. And it didn't work.
Sure.
So
it
it's
sounds like
not okay.
It's coming to the point of getting the right patient, the right drug at the right time.
Right. Right.
It'll get there. It's just hopefully something we'll see more of coming in the future. Darlene, pleasure.
Thank you very much.
Thank you so much.
Scenarios in Seconds was designed to be a simple and effective way to regularly train for pediatric emergencies. A Navy SEAL said it best: under pressure, we don't rise to the occasion, we sink to the level of our training. Ultimately, your next Peds patient could be your worst Peds patient, and we don't want you to just get ready, we want you to stay ready. And Scenarios in Seconds was designed to help you do just that.